Mr. Walker. My name's Shelby. I'm the nurse for your physician. It looks like your physician is starting you on Omeprazole for your acid reflux. You might hear it referred to as GERD. So I brought you in this pamphlet and we can discuss that medication for you. As mentioned, your physician did start you on this medication, and right here you can see all of the uses for it. But the reason why he put you on that is for the GERD resulting from the hiatal hernia that you have. And then he also wants you to take ranitidine and antacids, which is like Tums, and you can just take those when you're having flare-ups for it. You can open that packet and it's going to tell you more about the medication itself. How it works is it's going to stop the gastric secretion in the last step, and that's going to help with all of that, like the acid in your stomach, so it's going to help calm that down, and then also it's going to allow your esophagus healing time without having that irritation in it. And then, as you can see right here, it's going to have how you're going to take the medication, some common side effects, serious side effects, long-term side effects, and then interactions and precautions that you should take. I'll go over how to take it with you. You're going to take this 1 hour before meals. It's recommended that you take it at the same time daily, so you could take it an hour before breakfast. And then if your doctor prescribed you the capsules, right?
Yes.
Perfect. So yeah, you're just going to take that capsule. You're going to take it with a glass of water and then wait an hour before eating. You can also open that capsule up and mix it in applesauce to take it, or if you needed to get the packets that's got like the solution in it, you're going to open that packet up. 2.5 milligram packets is going to mix with the 5 ml, and then a 10 milligram packet is going to mix with 15. It has those directions right there for you. But once you mix it, you're going to let that thicken up, and then you can drink it, but you need to wait 2 to 3 minutes before you drink it to let it thicken up. And then if there's residual, you can add some more water and do the process over again. As I mentioned, your doctor did have you start Tums as well as part of your medication regimen. So that is one medication that you don't want to take those together. You want to wait about 2 hours. If you don't, the Tums will lessen the effects of the Omeprazole. Other medications on here that you should avoid are going to be NSAIDs. And those are common medications that you can get over the counter. So if you're having a headache, just make sure you're not getting any NSAIDs, which is like ibuprofen, naproxen. So you can also check with the pharmacist if you're getting these medications and just make sure that they're not NSAIDs or that they don't mix. St. John's wort's another common one that you just don't want to mix together. Are you taking any of these medications right here?
No.
Okay, perfect. Again, if you have any questions, call your physician or ask the pharmacist and they'll be more than happy to help you. Some precautions on there. I've already reviewed your chart. It doesn't look like you have any liver damage or kidney function damage. But if there were to be, if that arose or you heard a physician tell you that, go ahead and call your physician and let him know, as we wouldn't want you on this medication if that was the case. Some common side effects that you might experience is headache, nausea, vomiting. You might have some gas or stomach pain. Again, those are common side effects. If they're irritating to you or you can't handle those side effects, go ahead and let us know. Side effects that if you experience these, we're going to want you to go ahead and call your physician and let them know and stop taking the medication, is if you notice some yellowing of the skin, that's called jaundice. So you might see it on your palms or the whites of your eyes. If you have persistent diarrhea, if you're having joint pain and a red rash around that, any of those things, go ahead and stop the medication and call your doctor and let him know. And as I mentioned, this medication is not going to be used long term. There are some complications that come along with using this medication long term that we want to avoid. So for your diagnosis of GERD, you'll be on this from 4 to 8 weeks. Your physician has you a follow-up. It should be in 8 weeks to discuss if the medication's working for you or not. But those long-term side effects can be osteoporosis, which is bone weakening, and that puts you at a risk for having fractures. You can have peptic ulcer disease, and all of those are listed right here for you as well. And if you have any concerns regarding any of those things, you can go ahead and let us know. And then there's also an important box that I want you to notice right here. It says in case of overdose. So there's some symptoms right there that if you're experiencing those, we want you to seek medical attention. So if you feel your heart beating really fast, if you have a smartwatch and you see your heart rate going really high, go ahead and seek medical attention. All of these things on here, confusion, all of that. But if you're experiencing those, go ahead and seek medical attention. Is there any questions that you have for me about this medication?
No.
Okay, perfect. I'm just going to go ahead and just assure that you know how to take this medication. Could you tell me when you're going to take it?
I'm going to take this an hour before breakfast.
Perfect. And what medications do you not want to take together with this?
I don't want to take antacids or other NSAIDs
Perfect.
or other things listed on the side effects.
Perfect. And then you are prescribed antacid, so how long after taking an antacid should you wait to take the omeprazole?
2 hours.
Perfect. If you're experiencing rapid heartbeat confusion, what would you do in that case?
I would contact the emergency medical treatment.
Perfect. Well, it seems like you have a good understanding of the medication. And again, if you have any questions or concerns, feel free to call your physician or reach out to a pharmacist, and we'd be more than happy to help. I hope this medication works well, and don't forget to continue those lifestyle changes that you've made, continuing exercising. You can still sleep with your head slightly elevated because that can kind of help. Don't lay down immediately after eating. We still want you to avoid smoking and then cutting back on that alcohol, spicy foods, fast foods. These are all things that can still irritate your stomach, so we really want you to avoid those things. Anything that you notice as a trigger, we still want you to follow those recommendations, okay?
Okay.
All right, perfect. Well, it was nice meeting you. Have a good day.